survey, say yes or press 1. Otherwise, say no or press great. To take comment, we'll need to send you a text message with instructions. Are you happy to receive the message on the number you're calling from?
Hello.
Okay.
Hello.
Yes, I just checked on the students' module, but I cannot find the questions at all.
Hello, yeah, I'm with you, sir.
Hello, guys. Hello.
Hi.
Hello.
So yeah, okay. Joe, have you been able to log on to your model?
Yes, I just log into the module but I cannot find the questions at all.
Ademi,
Yes, sir.
did you guys speak?
There's today, and even today, I think I have some work after this. I told him to contact me today, but I don't know, maybe we can make that arrangement. But
Okay.
I want to ask him, are you using a computer or a phone?
I am using a computer.
Well, it's there. It's quite very. The models are there when you register. When you enter your password, I enter into your backup page on the website. You see it. It's there. Everything is there. You just need to follow it and navigate through them. Just try and understand them one after the other. Everything is there.
Yeah, thank you.
If you have a problem, can you contact the office, Joe? Because you should be by now. You should have started your assignment.
Yes, sir. If I have any problem, I will contact the office.
You need to contact the back of our office because by now you should have started your assignments. Okay.
Okay. Thank you.
Anyway, why? You have to look into values and principles service provision in a number of ways. One, when you are caring for people, it's important to show respect, dignity, inclusion, individual rights, and responsibility is very key when it comes to this. Can you guys see? Hello?
I can see.
Host. How many people without saying? That's what else. Okay. So just 1 minute. Host. Can you guys hear me?
I can hear you, sir.
Yes,
All right, then that's fine. Let's proceed. So when you are caring for people, you have to show them respect, dignity, and confidentiality, very key to that. And then we have to also ensure that our own values and principles do not interfere with the delivery of care. Very important that we as carers may have our own values and principles that should not interfere with the delivery of care package that you are giving to your service users. So it should not affect or we should not impose ourselves on the services that we are taking care of. Then we have to look at the principles and values that underpin the provision of care. We have to look at our values, and that consists of commitment to equality, quality of care, compassion, improving lives, working together for people, Everyone counts, and respect and dignity. Very, very key. What then will be these underpinning principles of care? One, to protect vulnerable services users from mistreatment and improve the quality of care. Caregivers must follow the principles of the Care Act 2014. Care Act, you have to read about it. Very, very important. The Care Act that stipulates the way you should go about in caring for patients or service users. Very, very important. It should be compassionate. It should be proportionate, and all that. These are things you have to read. The principles aim to emphasize that everyone in care is a human being with wants and needs. They define how important is it to involve a service user in the process of assessing their own safeguarding needs. The principles of Care Act 2014. One, it encourages caregivers to take a person-centered approach when safeguarding vulnerable adults. When you follow the principles, you too place the vulnerable persons well-being and peace at the forefront of safeguarding processes. They help you directly involve the vulnerable person and any nominated people who can help reach decisions in the vulnerable adult's best interests when managing safeguarding concerns and care plans. Very important. Very, very, very important. This is what the Caregiver Act does and encourages us to do. It's about person-centered care. It's about safeguarding of the patients or services that you are taking care of. Very, very important. What then are the 6 principles of the Care Act? We have the environment, protection, prevention, proportionality, partnership, and accountability. Where then empowerment means what? The empowerment principle encourages you to support vulnerable adults so they can confidently make their own decisions and give informed consent regarding their care. The protection aim to provide service users with clear, simple, and information about how to recognize signs of abuse and when to come to you for help. And that's protection. Okay. And then prevention, we have to follow the prevention principles. You must be proactive to stop safeguarding concerns from developing in the first place. They say prevention is better than cure, isn't it? Then you have to look at the proportionality to make sure safeguarding process. Hello, guys.
Hello.
What happened?
Hello.
Anyway, accountability. Okay, let's look at proportionality to make sure safeguarding processes proportionate to involve the vulnerable adults when making decisions. They can give you input on what actions in their mind have the least impact on their quality of life and dignity. And partnership You should partner with local services, communities to help prevent, detect, report suspected cases of neglect and abuse. When multiple authorities recognize a safeguarding issue and submit a report, authorities can react quickly and confidently. And lastly, accountability. Be wholly transparent about and take responsibility for all the safeguarding practices you use to support the vulnerable people. Very, very, very important. But then how can we also look into the dignity agenda? What does it stand for? Dignity in care policy, the aim of the policy is to achieve high standard of patient dignity and to place the patient experience high on everyone's agenda. The policy provides a framework and standard for improving the experience of patients in all areas of the trust. Very, very key. It's more to put the patients on top priority, okay, so they could improve the patient's trust for you. What then will be the duty of care? You not only have a duty of care to the individual that you are caring for and supporting, but also to other workers. For example, if you were working in the hospital, you should have a duty of care to doctors, nurses, healthcare support workers, caterers, cleaners, and the maintenance worker. Very, very big. So duty of care is not only relative to the person that you are taking care of as a patient, but also towards your colleagues at work and the other people that you work with. Same way, they also have duty of care towards you. So it is complementary. Okay. Yes. So safeguarding also, when it comes to safeguarding, it means protecting a citizen's health, well-being, and human rights, enabling them to live free from harm, abuse, and neglect. It is an integral part of providing high-quality health care. Safeguarding children, young people, and adults is a collective responsibility. Then the ethics. Healthcare ethics refer to a set of moral values and principles to be used for decision-making in the field of medicine. For example, this confidentiality code of conduct. They are very key when it comes to this thing. Then we have to look at, outline how these principles impact the provisions of care. What impact do these principles have on the provision of care? So let's look. What are some of the impacts that principles can have on the provision of care? One, on quality and safety of care. Ensuring that the right services are offered and that they are of a good quality whilst considering the paramount safety of the service user. Very, very important. Support for rights of individuals. Having the right support given by the most appropriate services. Refer to the most appropriate services if required. Mental health, bereavement, specialized treatment, and all that. So you have to ensure that the right support is given by the most appropriate services. Okay. So bereavement, if somebody has lost someone, it should be the bereavement support department. And if it is mental health patient, then it needs a mental health support department. Then we have the how to look into consistency and coordination of care, that there is a consistency of care, service users having access to the same set of carers to ensure consistency and that care is coordinated well. You know, that there is a consistency of care, service users having access to the same set of carers to ensure consistency and that care is coordinated well. There's also an impact on the failure to comply to the provision of care. This can lead to poor quality of care, infringement of rights, safeguarding issue, striking up by the professional body, and then it can also lead into imprisonment. I think we spoke about this yesterday. So if you don't comply with the provision that has been given to you, obviously it may affect the poor quality of care that is given. You might be abusing the rights of the patients and might also raise safeguarding issues. And in general, this as a result can lead into your license being taken from you as a nurse or a carer. Okay. Do you have any questions at all? Any questions at all?
No questions, sir.
No
Okay.
questions, sir.
So what may be some of the initiatives within the UK that promote fundamental principles of care within the health and social care sector? One of those initiatives are the UK Dignity Agenda, promotion of rights, the person-centered care, and the 6 C's. So let's look at, first of all, the UK Dignity Agenda. For example, the United Lincoln Hospital NHS Trust is committed to ensuring that all patients and their families and carers are treated with dignity and respect throughout their care journey. Dignity of care, very important. Okay. Then we have dignity in care in everyone's business. Whether engaged in direct patient care or working in one of the many supportive roles within the organizations, each employee must understand the impact of their words and the actions upon qualitative patient experience. Very, very important. So you might be an administrative staff. It doesn't mean because you are not direct dealing with the patients and service users, so you could abuse the system or misbehave. No, you should still comply with the structure that is in place in taking care of patients. Administrative, cleaners, they all have to have dignity of care in everything that they do, whether you are direct or indirect. Then we have dignity in care policy. This aim of policy is to achieve high standards of patients' dignity and to place the patient experience high on everyone's agenda. The policy provides a framework and standard for improving the experience of patients in all areas of the trust. That's to do with the policy. All is to achieve a high standard of patient dignity and place the patient's experiences high on everyone's agenda. This is very key. Okay. Then we will have to look into what the policy articulates. It articulates clearly that every employee would uphold values and behaviors to the highest standard in relation to dignity in care. This includes to put the patient and the public at the center of our work. They will treat patients, colleagues, and visitors with respect, dignity, and empathy. The policy also has sections relative to service provision and building design, education and training, some gender accommodation, care provision, and advocacy and advice. Advocacy and advice. Provision of the NHS follows the Human Rights Act and promotes each individual's rights. The Human Rights contains 15 basic principles. The last time I spoke about this, the right to live, the right to be tortured or treated in inhuman or degrading way, the right to be free from slavery or forced labor, the right to liberty and security, the right to fair trial, the right to punishment without law, the right to respect for private and family life, home, and correspondence, the right to freedom of thought, conscience, and religion, the right to freedom of expression, the right to freedom of assembly and association, the right to marry and found a family, the right not to be discriminated, the right to peaceful enjoyment of possession, the right to education, and the right to free elections. These are all your rights that you need to know. Now, person-centered care. In healthcare, the person-centered care is where the patients actively participate in their own medical treatment in close collaboration or cooperation with the healthcare professionals. I've explained this severally before. What then is the 6 C's of person-centered care? Care, compassion, competence, communication, courage, and commitment. Okay. Classic activity. How do you think that these principles support basic human rights? How? So let's look at how we can look. Principles that are used in healthcare provide a set of clear ideologies for setting and evaluating health policy and service delivery. Targeting discriminatory practices, unjust power relations that are of the heart of inequitable health outcomes. Okay, what do you say? These are the underlying principles that support basic human rights. Principles that are used in healthcare provide a set of clear ideologies for setting and evaluating health policy and service delivery, targeting discriminatory practices and unjust power relations that are at the heart of inequal health outcomes. Very important. Then we have support rights to respect, dignity, inclusion, impartiality, confidentiality, individual rights, and responsibilities. Very, very important. Very, very, very important. Responsibilities. We also have to have empowerment, protection, which we spoke about this. Partnership and accountability, safeguarding equal access to care. The overall underpinning principles and values ensure quality, access, and coordination for all service users. Okay, for all service users. It is important to know that even recognize that even though many of the principles and values may not be mandatory within healthcare, there are implications from not following them. And we mentioned that already. It leads to lack of quality, breach of rights, accessibility, serious injuries. We mentioned that already. Ill health for service users if you don't comply, inadequate services, miscoordination, and missed appointments result in lack of care for service users. Negligence. Clinicians, carers may fail to conduct themselves in an appropriate manner, leading to failure to take proper care of their service users. Gross misconduct. When someone causes harm through serious negligence, is unable to perform at work, and due to alcohol or illegal drug use, or commits a serious breach of health and safety regulations. This is what we call misconduct. And all this could lead into your license being taken for. So today we've looked into describing the underpinning principles of health and social care, outlining how these principles impact on the provision of care, explaining the initiative to promote the fundamental principles about those working in health and social care, assessing how underlying principles support basic human rights, assessing the implications of failing to adhere to fundamental principles of care. All right, this is what we had, and we have references of student model. Okay, do we have any question at this stage?
No questions, sir.
Sure.
Yeah.
It's for all right for me.
Okay, so so let's look at the assignments. The assignment brief. Let me outcome 3. So here it says the final section of your guide looks at principles and values that underpins the provision of care in your chosen country. You should describe the underpinning principles of health and social care, outline how these principles impact on the provision of care, explain initiatives to promote the fundamental principles among those working in health and social care. To get merit, you have to be able to assess how underlying principles support basic human rights. And then to get distinction, you should assess the implications of failing to adhere to those fundamental principles in your learning outcome 3.1, 3.2, 3.3, and 3.4. So these are the last bit. In this session, learners need to identify and describe the principles underpinning health and social care, which, for example, set up a duty of care and ethical code. They should consider how this impacts on the provision of care, e.g., quality and safety of care offered. Learners need to explain initiatives to promote fundamental principles, such as in the UK Dignity Agenda and the 6 Cs. To get merit, learners need to explain how underpinning principles and values ensure quality, access, and coordination. And then to get distinction, learners should recognize that though principles and values may not be mandatory, there are implications from not following them, which may include lack of quality and breach of rights. Okay? So you can find these things and read about them. This is what we call your assignments. Let's discuss the assignment discussion itself. So I'm sure we might do that tomorrow, but look at that. So the task 1, task 2, task 3. Let's look at task 3. Task 3. So that's it. The final section of your guide looks at principles. You should describe the underpinning, then we have that. So you get merits to get distinction. You've mentioned that you have 2 weeks from the assignment discussion date to submit your coursework. Are you there?
You have 2 weeks
from your assignment discussion date.
Okay, sir.
Okay.
Okay,
Use
sir.
the educative content on the unit specification document, such as guide, to show to how to structure and answer the assessment criteria. The assignment should be submitted to learner at UK Versity. Assignment presentation, document structure and format. It is good practice to put the unit number and the name. Start with a bit of introduction to the unit. 3 to 50 introduction. Write out the LO if you are mentioning it. Otherwise, it is not required. Font size to be 12. Line spacing, 1.5 page number to be inserted. Table of content to be drawn. Conclusion, 230 words. Reference and bibliography. This is what they expect you. You can get all this on your model. Okay. All right. Guys, can you hear me? Hello?
I can hear you.
Yes. Do you have any questions at all, please?
No questions.
You any questions?
No questions, sir.
Come again.
No questions at all.
You have no questions, okay? So if there's no questions, probably I'm sure we'll have to next week then, okay?
Okay, sir.
Joe,
Okay,
if you please contact me, your friend, to help you, all right?
Yes, sir. I will contact him at the evening, okay?
Okay, that's fine. Take care, guys, okay?
Okay, thank you.
Thank you, sir. See you.
Bye.
Bye.
We're sorry, our lines are very busy. Yesterday, the average wait on this line was 20 minutes. You can save time by letting our digital assistant help you. Most of our customers find the information they need here. Just hang up, go to gov.uk and search Contact HMRC. Please ask assessment, then go to Ask HMRC Online. You can also find lots of information about self-assessment in the HMRC. Download the app, go to gov.uk and search HMRC. To help improve our services, it would be helpful if you could answer 4 short questions about your experience of calling HMRC today. This should take less than a minute of your time. Would you like to take part? Take part in the survey, say yes, or press 1. Otherwise, say no, or press 2. Okay. To direct your call to the right place, I'd like to know why you're calling today. So tell me, in a few words, what's the reason for your call? You can say things like, I need help completing the self-assessment return. I need to register for self-assessment online. Or even, where is my self-assessment repayment? So go ahead, tell me, what's your reason for calling? Please say one of the following: refunds, penalties, return, statements, registration, tax calculations, or something else. For refund, press 1. Penalty, press 2. Return, 3. Statement, 4. Registration, 5. Tax calculation, 6. Or for something else, press 7. Okay, so you're calling about your own account. Thank you. To get help with self-assessment, go to YouTube and search for HMRC's YouTube channel. Here you'll find useful playlists which will inform and guide you. You can also find help sheets on gov.uk by searching for self-assessment tax returns help sheets. If you're on Twitter, you can also ask general questions by tweeting at HMRC questions. For security reasons, we cannot discuss your personal tax on social media. Please hold, we will be connected to the next available advisor. We're very busy right now, so you may need to wait longer for your call to be answered. You can find help and information online at gov.uk. We routinely record calls for quality, training, and security purposes. We may need to ask you additional security questions before being able to help you. If you're employed or have a pension, please have your payslip or pension details ready. You can find out how HMRC processes your personal data by searching for the HMRC accredited list on gov.uk.
So one's getting point. You have to check it. And yeah. I must go for another check on that.
but woman and friend because when they can solve band with them, it is a my woman and friend now okay now. Mine no Italy, but Italy cancer for a French, but what's not Ghana, it was a what a tree or something Italy can.
Well, great camera. So,